In terms of the second wave, we don't know. Part of me, the optimist or the one who hopes, maybe there won't be a second wave. But every other pandemic in recorded history has had at least 2 waves, some more. Whether the second wave will be more severe than the first, whether there'll be a series of smaller waves, I don't know. I don't think anybody knows. There's a lot of theories around the world. What I do know is that we need to keep putting the pressure on this virus to make sure it doesn't take off. And that means we can't expand our circles too much in the coming weeks and months, because we don't have immunity, and nobody around the world has sufficient immunity to prevent transmission of this virus, even those places that have had more severe outbreaks. And we can see how it can very rapidly increase and accelerate an outbreak very quickly. Other thing I do know is that influenza season comes every year, and we expect we will have influenza this fall. We don't know if it's going to be a severe season or not, so we were going to have to do everything we can to minimize influenza, and that means the importance of influenza immunization and the measures that we're taking to prevent COVID now that we are thinking of will also prevent influenza. So we have to be mindful of that coming into the fall. It will also make it more difficult when we start having influenza season, detecting COVID outbreaks, because we know that we'll see a lot of people ill with influenza again. So it's all very, it's all complicated. There's a lot we don't yet know, but as I've said, we're watching and learning from everybody. We talk with colleagues around the world. There's much research going on into treatments. There's a lot of research going on to vaccines, the surveillance and the work that we're doing in public health to try and keep track of this in our community and be very sensitive and monitor. And then everybody else doing their part by making sure we keep our contacts manageable, so that if one of us does get infected, we're able to stop those transmission chains very quickly. So that's the best I can do for prognosticating.